Stephanie Belplant joins us now to talk about plastic surgery. Now, if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. And this is a special topic today, so we'll have plenty of time to take all of your questions. Joining us is Dr. Manisundaram. Thank you so much. And you are with the clinic of...
I'm with the Plastic Enhanced Surgery Associates. We are with the Face and Body Center of the Plastic Enhanced Surgery Associates. We are located in Flowood, right across from the River Oaks Hospital.
Okay, now you've got some demonstrations you're going to show us today, right?
I do have
one thing in particular. I mean, I know people, the gastric bypass is real popular. It leaves people with a lot of skin, and one popular thing is to lift it up.
My interest has been in plastic surgery after weight loss. I do see several patients that are interested in taking care of the excess skin they have after weight loss, and I do have an illustration of a patient that had lost weight just by diet and exercise. She is a 38-year-old mother of 3 children that lost 55 pounds with diet and exercise. It's amazing that she did that with a full-time job and also homeschooling 3 children. I can show you some before pictures so that we have a better understanding of what was done for the patient.
Okay.
This is the picture of the patient preoperatively. The patient had decided that she would need a tummy tuck, or commonly known as an abdominoplasty, which would be removal of the excess skin and tightening of the muscle. After my initial consultation with the patient, I felt that she would be a candidate for what is called a lower body lift. That entails a buttock lift and a thigh lift at the same time.
It's amazing, the difference.
And Barbie's behind looks like a bird. Oh, I'm sorry.
Leave it to Stephanie. Thank you, Stephanie.
I'm going to go ahead and show you the amount of tissue that was taken out during surgery.
Yes.
But looking at this picture, you would not think that there could be so much amount of tissue that's available. The patient had 5.5 pounds of tissue taken out from. These are the tissue that was taken out from the back, and this is the amount of tissue that was taken out from the front. As you could also see, in patients who desire a Brazilian butt lift, this skin can be left behind to produce a butt lift, which is also like a J-Lo butt. But this patient did not desire that.
Okay. She didn't want the J-Lo butt.
She did not.
Okay.
Well, show us the afters.
I'd like one.
Stephanie,
I can show you all some before and after pictures.
Wow.
The patient was primarily interested in getting rid of her post-baby pooch, as you can see here. But when I saw her, I felt she also had some looseness of the thigh and the buttock area. All of the incision is kept within the bikini line. I do mark it with the patient wearing a panty of her choice so that I can keep the lines beneath her bikini. And this is the before and after. You could see the drastic reduction in the baby pooch. You have a perfectly vertical line. You also see an improvement in the thigh and the buttock area. And again, I show you a right lateral here. You see a vertical line where you don't have the post-baby fullness, and also I do tighten the muscle with some permanent sutures. So this is a procedure that's going to last forever.
And
That
of course,
amazing.
Stephanie's exactly right. That is me. That's my body.
That's where Barbie was all fall.
Oh,
No, not
wow.
all fall.
Just 2 weeks.
Just 2 weeks. Took 2 weeks, and Dr. Manny, I mean, I tell you, he's done wonders. And I'm wearing things that I've never been able to wear before because I got rid of all that extra skin. But in fact, we have a question from someone wanting to know, at what point should they be able to consider having a tummy tuck? How much weight should they lose before having like a procedure like that?
I normally tell my patients that you should have a stable weight for at least 6 months, and you should be less than 29 on your body mass index, because a lot of times people like to refer to the body mass index. I would like to say if you're below 29, it's a good choice. There are several ways of trying to get it down to that weight. They could do it like you did with diet, or they could have the bariatric surgery if they are borderline obese or moderately obese.
Well, we're getting lots of questions, okay, Dr. Manny. Here's one, someone who has been told they have a squamous cell skin cancer on their nose, and they've been told that they're going to have it taken off. With that being said, what can I expect after surgery on the nose? I think what I'm gathering is she's wondering if she's going to have some plastic surgery to fix where they take off the carcinoma.
A lot of times it depends on the size of the spot. There are guidelines for removal of squamous cell carcinoma, which is a margin of 5 millimeters around the margin of the cancer. So if she has a fairly large lesion, she will end up with a plastic reconstruction, which would either be a skin graft or a flap.
Okay, here's another one. I'm 25 years old, and last August I had saline breast implants. It's already been a year ago that I had this surgery. The last time I saw my doctor was for the after-surgery checkup, and since then I've not been back. How often should I visit my doctor for checkups? Also, I've been feeling a little burning or stinging sensation in one of my breasts. It isn't painful, but I wonder if it's normal. So the first question would be, how often should she go back to her doctor for checkups? And it's already been a year.
Since it is a saline implant, we just tell the patient to follow up with us if there are any problems after the procedure, where if they get any firmness in the breast or they feel that one of the implants is possibly deflated, which is not a common thing. For a patient like what you described, it is nice for her to call her plastic surgeon and consult him.
Especially if she's having some burning sensation?
It is usually related to post-surgical discomfort from something new she might have picked up, some kind of a workout, but if she's having a burning sensation that's not going away, I would advise her to go see her plastic surgeon.
Okay, here's one more. My eye doctor said I need plastic surgery because my tear ducts are stopped up. Is that right? How would it be done? What could you expect?
Any problems you have with the tear duct, I would refer to an oculoplastic surgeon, somebody that does plastic surgery of the eyelids.
Didn't know there was such a thing.
I didn't either.
And insurance will pay for that too, I think.
That's amazing.
If
You
it's
did
for
a
medical
fantastic
condition.
job with Barbie.
You did.
She looks absolutely
He did a
great.
fantastic
She's
job.
beautiful either way, but I mean, she's even more
Appreciate it.
beautiful now.
Well, Barbie had done everything she could, and she realized that she could not get rid of the excess skin, and I felt this was the right procedure for her. Although she came just for a tummy tuck, I felt she would benefit more from the lower body lift, which is a combination of a tummy tuck and a buttock and a thigh lift.
I'll tell you, I've gone from wearing, size 8s and 9s down to wearing 4s now, just by getting rid of that extra skin that, after you have your children, you think, I'm doing everything right. What am I missing here? Wow. And who would have thought that extra skin after having children and gaining weight and losing weight over the years?
And especially somebody who's as motivated as you are, it's easy for you to maintain your weight. It's not going to be a problem. And you also had a good support system at home. William was great help.
Yeah.
Well, she told me when she got back, she said, he gave me Victoria's Secret thighs.
He did.
Thank
Dr.
you so
Manny,
much.
thank you
Dr.
so
Manny.
much.
You're welcome.
For more health news, you can log on to our website, WLBT.com, and click on Medical Matters.